This video, I'm giving a small one, is mainly on coronary thrombosis. The narrow outlet through which blood enters the heart is called coronary artery. Due to some obstruction, it may get blocked, resulting in blood not flowing to the heart. Now, this is a common problem with middle-class families. So, by which many people think due to the hard work and strain and tension and worries, this problem comes. Yes, this is one part of it, but the major part is on the way we live, our day-to-day living and our diets we take, and due to the late eating habits and non-regular eating habits, our evacuation becomes irregular and we get more of insoluble fats, and that all things effectively makes more of acids in our system, which I have said on my last video on acidity, and due to which the clogging on the arteries happen. Now, blood gives nourishment to all glands, nerves, muscles, bones, etc. If this blood becomes too much acidic, the arteries in contact become thin, they lose their elasticity and blood clots then. Our body system at this stage fails to supply blood to the heart, and the result is angina, pectoris and other various diseases of the heart. Now we must plan our living, our diets in such a way, whatever diet we take, so we ourselves have to think that by consuming this and this, how is our evacuation, our passing of bowels happening? If it is not happening properly, our stool is not well formed, so we should change in our diets. Everybody's construction is slightly different. In fact, every individual is a right doctor for himself or herself, by which he, in his day-to-day activity, can plan his things, his diets. And in today's global world, you can check at net and see what is actually right for you, and you can interact with different peoples. But main thing depends on you. You are the doctor of your system. You know what you actually are doing in day-to-day activities, what kind of food you are taking, and what is your life way, like even your mind, how your mind works out, your psychology, all those things depends. And the main reason is food, what you take. You should avoid non-vegetarian food. In fact, our system is not made for non-vegetarian food. Our system is made for food which is easily digestible, vegetarian foods, because vegetable proteins requires much less gastric juices to get digested in comparison to animal protein. So we should avoid animal proteins. We should take more of vegetable proteins like nuts, groundnuts. They give the same amount of proteins and they get digested easily, and they don't create all surplus toxins in the system. I have given asanas and movements on my other videos about this, that is Agnisar, Kriya, pawanmuktasana and paschimottanasana. One can take support of wall also and do that, but it's better to avoid props because then you become habituated to that. One has to understand the body mechanics, and that too with the space. But here I'll explain only moving meditation, which is very easy and very effective, and many other diseases. I have worked with people like there was a businessman, he was losing his breath. He went to US, UK, and nothing was worked, He spent a lot of money. I just gave him these few simple moving meditations and in conjunction the breathing techniques. So that affected his being. So that's why I'm giving it here for beneficial of everyone who can. Now we should start from Vajrasana, sitting on this way, because this posture keeps our spine in a question mark natural state. So it is actually, if the spine is proper, the vertebrae, every vertebra taking the nerves, veins to the different organs like liver, heart, lungs, and these same veins are and arteries or whatever you call as they go back to the neurons and the whole complex system works on. The main basis is vertebrae, every vertebra. So that's why I recommend this pose. Now in this pose you first sit for some time and observe your breath going inside, count 1, breath coming outside again, count 1. Feel the breath going inside, feel the coolness or warmth as you are aware of at the terrain condition of your country. And breath coming outside, again feel that, whatever you feel, and count again 1. Counting is because your mind should not go on different subjects, different modifications of mind, and if that happens, then again tension, worries and things comes, and then again you are into same conflicting state. So you count breath and feel the breath. Look at the inner sky after closing your eyes inside, so that you're totally away from the world and your thought modifications. When you open your eyes, you be aware of the space, time and your body in the space and time, and you keep your body and its parts and move in conjunction with that, so that you can entwine your breathing into it. Now what movements I'm showing here, you keep the ratio. You inhale 1 and try to exhale 2. Suppose you inhale 1 count, exhale 2 count. You inhale 1 count, you exhale 3, exhale 4. You have to make your ratio as 1:2. Start with this mudra. 1, cross fingers, 2, 3, cross finger, 4 and 5. This connects all the sinus points in your brain and the body. This is very good for improving your memory. It's very good for kids, students and all of us. You can sit in this for some time and put your mind on breath also, count the breath also. And if you are relaxed, everything is fine, and come back into normal state of your being and do this mudra. From this mudra, you get up slowly and inhale. Inhale 1, inhale 2, inhale 3, slowly. When you exhale 1, exhale 2, exhale 3, exhale 4, exhale, full exhale, and full inhale, full exhale, relax. The same thing, you can do more and more these movements, and in a way that you make your inhalation in the ratio of 1 and exhalation 2. Your exhalation you should increase, and in a way, if increasing exhalation, if you hold it, it is not very dangerous, but increasing inhalation, if you hold it, it is dangerous. So I am advocating increasing exhalation, and this exhalation you can hold also. There is no harm into it. You can exhale more and more, because whenever we breathe, it remains as a residue in our lungs. So if you increase your exhalation, it goes away. Thank you.